Welcome to another edition of Falmouth Cares Business Roundtable. It's our pleasure to be with you for yet another show where we share experiences and talk about the impacts of the coronavirus here in Falmouth and beyond. As always, we have a great panel. Bill Zammer from the Flying Bridge, Michael Kasparian from the Falmouth Chamber of Commerce, and tech executive Gary Bacon. We have some great guests today too, but before we get to them, I would like to take a moment, as we always try to do, to really thank the people on the front lines of this pandemic that are helping our community survive during this very difficult time. Our frontline public safety workers, our police and firefighters, most certainly medical workers, doctors and nurses and hospital staff, and even the folks at the local grocery store and the folks that are helping our businesses stay open as we talk more and more about expanding what opening means. Those frontline people will become all the more critical. So we sincerely thank you all for everything that you do. So today we're very pleased to have with us a couple of wonderful representatives of Falmouth's faith community, the Reverend Nell Fields from the Wacoit Congregational Church and Reverend Will Mebane from St. Barnabas Church on the Village Green. So we're very thrilled to have both of you. And of course we're very pleased to have a member of the Great and General Court of the Commonwealth, Representative Dylan Fernandes, who has joined us to provide a perspective on what's happening on Beacon Hill. But before we get to our guests, we'll chat as we have become accustomed to doing with Gary, who is not only our statistician, but really will get into some depth about the trends for coronavirus, what we're seeing here in Falmouth, and what it means now that we seem to be heading toward a phased opening of the local economy. So Gary, as always, thank you, and I will turn it over to you.
Okay, thank you, Troy. I'm going to take the screen and start with the usual slide of disclaimers. These are all my data sources, and the testing is still fairly limited. In the US, we've tested 2.74% of the population. That's 0.08% of the US population per day that we're testing roughly. In the Massachusetts, we've tested 5.63, about double that, about 0.17% of the Massachusetts population every day. This is coronavirus testing. And these are not random samples, so statistical inferences are tough to make, and that makes forecasting hard to do. So that all said, let's look at some of the public data. If we map the corona growth factor, which we'd like it to come down to 1. If you look at the 1.1, that's 10%, 1.2, that's 20%. That's kind of growth per day. And growth per day is like compound interest. We've talked about this quite a while. We're down close to 1% now. So this has creeped down over the course of this, and that's good news. The other really good news over the past a couple of weeks is that you can take a look at the Massachusetts daily new cases, which have been drifting down. And this lower graph is the number of tests that we do daily. So we try not to look at these tests. If the tests are going down, but you're not testing very many people, that's harder to read. But if you blur your eyes, you can see that it looks like we've kind of crested the hill and we're starting to come down the other side. You don't know till you know, but the data is promising. We talk weekly about the University of Washington projection model. They radically updated their model over the last week or so. This is, again, the model that this group is funded by the Gates Foundation, some really smart people there. They went from a model that was very much focused on death rate, looking backwards, and they updated it to consider kind of infections, this so-called SEIR model, where you start with susceptible people, you figure out who's exposed, you move on to infected, and then on to recovered. And when they went to this model, it kind of extended the tail, which is kind of what you see in New York, which is you kind of go up the hill faster than you kind of go down. And they also updated the model to reflect policy changes that happened nationally, including the opening up of a variety of states and the additional mobility between people. Now, the bad news about this forecast is over the course of the last week, when they updated this model, they kind of doubled the total death forecast from the first wave of this virus from around in the 70s to, about double that number, which is, we talk about death in this like it's just a number, and we all know it isn't. So now let's go to Massachusetts in this model. As the model's gotten more sophisticated, they're looking at kind of this mobility idea, which is if you looked at where we were in mobility up here and where we went as we closed down the state in April, they're saying that, we're at maybe 60% less mobility, or people bumping into each other is kind of as before, but they imagine this creeping up as we relax social distancing a little bit. And when you look at their model, this is a really interesting new aspect of the model where they're modeling three different things here. These three things, but two of them are actuals. These are tests, this little jagged line. These are the daily tests that we're doing. These are the daily infections that we're finding. But this is their model of how many people they think are actually infected, which you can see there's quite a gap between the amount of testing we're doing and how many people, they think are infected in their model. That's a bit of a swag, but, they've got that, probably down to about 5 times. At one time, it was more than 10 times the infection rate. And that's, again, because of the limited testing. And this is their model of deaths per day for Massachusetts. Now, let's start comparing this to actuals. And here's some data from the Massachusetts Department of Public Health. This is also encouraging data where we were at roughly nearly 4,000 hospitalizations at peak. And there's been net discharges, as you can see over here, and we're down to around 3,100 people in Massachusetts hospitals with COVID now. That's good. This is apparently a downward trend. Hope it continues. Also, the death rate in Massachusetts, the actual death rate as per the model is actually going down. And also another important aspect is when you look at the number of tests, if you look at this red circle over in the corner, this is the number of tests that are, when you do a test, what percentage ends up being positive. And kind of in the peak, we were up around a third of the tests, 33% were positive. Now we're creeping down around 10% of the tests are positive, and that's also a good sign. So I want to move on from here to talk about Governor Baker's announcement today at his press conference earlier this afternoon. Just like we talked about in Washington State last week as a model, he's talking about a 4-phase program to reopen the state. Where there's a first phase, a second phase, a third, and a fourth, where there's reduced restrictions. And he talked quite lengthily, that's not the right word, but he talked at length about the possibility of going backwards if the numbers tell him to go backwards. The exact nature of what happens at each one of these phases, and which industries get to work and which ones don't, and so forth, they have not, Massachusetts has not disclosed yet. But we'll talk about another example, which is New York, where they're ahead of us in terms of where they are in terms of the virus and the curves and what these look like for New York. And they also talked about some overall protocols that would be in place, even with the phase 1 reopening, which would involve, social guidance, workplace standards, and also workplace standards that would be specific to particular workplaces. And then they talked about some standards that would apply to everyone, which would include continued social distancing, some hygiene protocols, some staffing and operations issues to keep people apart amongst your staff, and cleaning and disinfecting protocols. So the details on this, the state has talked about releasing further details on this on the 18th, about a week from now. But in the meantime, we can look at some other states.
Barry, interrupt for one moment.
Certainly, Bill. Yes.
Did anyone mention places of worship in that? Or are they phase 3 or 4?
They have not. From Massachusetts right now, what is in each phase is not disclosed, right? So they're talking in general about a 4-phase program. We can look at other states, though, and we're going to look at New York in a second, which is ahead of us. Last week, we looked at these two curves. This is the New York curve, and you can see, I mean, if you blur your eyes and look at this curve, infection rate curve, and you look at the one in Massachusetts, Massachusetts is probably someplace around here, and they're further along. We also talked about whether being in a warmer climate had an impact, and I think this the court is still out on that. And Florida, as you know, has been kind of laxer in terms of constraints. So this one is one that we continue to watch every week. But I want to talk in detail a little bit about what what Governor Cuomo talked about today in terms of the New York State reopening plan, because it may give us some insight as to what we may hear in another week from the state of Massachusetts. So they're talking about the CDC guidelines, and they're talking about watching for a 14-day reduction in hospitalization, some kind of rolling average, before they let things start to happen. And then they're talking about prioritizing industries by phase. Phase 1 involving construction, manufacturing, and selected retail. Phase 2, professional services, finance, retail, et cetera. And you can read the rest of it. Restaurants all the way up to Phase 3, and hotels. And then finally, arts, entertainment, recreation, Phase 4. So this is what he's been talking about. But understand in New York, and I don't know if they'll do this in Massachusetts, there's a lot of talk. In fact, his plan is to do this regionally and not treat New York as one thing. For instance, the Finger Lakes would be treated differently than New York City. He's also talking about keeping an eye on these metrics, making sure he still had 30% of his hospital and ICU beds available, making sure that he had enough of a testing regime. We could perform 30 diagnostic tests for every 1,000 residents per month, and a tracing system with at least 30 contract traces for every 1,000 residents, so that they can go after infections and figure out who talked to who contacted who, and trace those things and isolate the people who became infected. So, and finally, you know, as far as New York is concerned, the treatment of New York City and the treatment, for instance, of the Finger Lakes, and in terms of the extreme example, is different. You know, when he ran his 7 tests, who's ready, who's not, clearly places like the Finger Lakes are ready, and clearly places like New York are not, New York City are not. So they will do it regionally different, which may happen here as well. So that's what I have for today. I'm going to bring back the Hollywood Squares here.
Hey, so Gary, I can just comment a little bit on that. So some of the conversations we've had with the administration, and this isn't carved in stone, but they are actually looking at a geographic possible opening in Massachusetts. We've been told because of the seasonality, the Berkshires, Cape Ann, Cape Cod, and the islands, and because of the exact difference of numbers, there may be some consideration given to that. But of course, you know, on the other hand, it's also been said that, you know, if you do open up those areas sooner and more people flock there, you've got that part of it too. So I think that I think this administration, the governor, has shown how thoughtful they really are, and I think they're taking everything into consideration. And I'm certain once the 4 phases are specific and come out, there will have been a lot of consideration given. It'll be a good plan going forward.
Well,
just to piggyback on Mike's point, just really quickly, it's an excellent point by Mike. You know, compared to New York, Massachusetts is an incredibly small state, and actually compared to many other states in the country, Massachusetts is a really small state geographically, and we also have one of the highest population densities. And so that makes it a little more of a challenge to do things geographically, because it's so much easier for folks from Boston to go down to the Cape, or from Worcester to go to the Berkshires, or something like that. So to Mike's point, I know it's being considered. I know there's some thought going into it, but there are certain challenges with that Massachusetts has that New York won't have.
And just one other point on this too is Governor Baker's been on the forefront of trying to set up a testing and tracking organization, and I think that's something to be really commended. That will make an opening safer than if we didn't have it.
Sure.
We've already today seen the value of having this group, and this is why we continue to do this show, and why we will continue to do it as long as it's useful for the community, so that we really have people like the representative who are on the front lines of policy making that can explain some of those factual nuances to us. So as we look toward what a phased opening of our society will look like, understanding how people can come back together and congregate is a really important factor. And so to you, Nell and Will, literally a big part of the faith community is people's ability to come together and congregate and be together in fellowship, whatever their faith. So how have the last couple of months impacted the way you gather your congregations together and ask them to join together and worship? Nell, we'll start with you.
Good, thank you. We've read recently that there have been some pastors of churches that have asked the governor to allow churches to reopen. Let me assure you that Wacoit Congregational Church never closed. We've always been opened. We just don't gather in that sanctuary. I call this forced innovation. It was clear to us in maybe March 5th, March 6th, that it wasn't going to be wise for us to be in our sanctuary, which is tiny. So that Sunday, we were on Facebook Live and Zoom.
Nice.
And that is how we have been gathering. I'm not going to stop it. I'll tell you, people enjoy coming to church in their pajamas.
Yeah, that's true.
Yeah, and okay, there you go. And it's a new way to connect, and I call it connecting. And throughout the week, we have different ways to connect. We have coffee with the minister on Tuesday. We have a devotional on Wednesday. We have a mini concert on Fridays. So quite frankly, I think this is going to really help save some of our faith communities, because we have a way of reaching out in different ways. On the other hand, it is a challenge. We are getting new people to join us. We have more people watching Wacoit services than ever fit into our tiny sanctuary. But I think moving forward, the challenge is going to be the same thing that businesses are facing is, how do we get donations? How do we get pledges on a regular basis? And people, for the most part, we're doing well. But, 5-6 years from now, that might be a challenge.
So, Will, I'm guessing you're facing some of those same challenges. I guess the challenge to innovate, but also the challenge to really track your long-term viability as an organization, because both of you have congregations, but you also have buildings to maintain and all of those things that come with any organization. So how have you adjusted to this pandemic and the ever-changing new normal?
Well, I think one of the most unfortunate things that happened from the very beginning was the use of the term social distancing, because this is a time when we need to be together socially more than ever. And I wish we had used the term physical distancing, which I know some people have started to try to use. And so to keep us together socially, one of the first things we did was create a new ministry as part of our pastoral care offerings here at St. Barnabas. And we had 25 people volunteer to become ministers of encouragement. And we used the term encouragement because Barnabas, the name of our parish, means son of encouragement. So we now have women and men, about 25, as I said, of them, calling everyone within the congregation, just checking in, seeing how you're doing, what do you need? And everyone so far has been doing very well. Several people have said, you don't need to call me every week. You can call me every other week, it's fine. So that was one of the first things we did. Then I started doing something called a daily message of encouragement and posting that on YouTube and then also on our Facebook page. Just a 2, 3, 4 minute brief meditation or offering of encouragement for folks. And that has been very well received. We now have had some of our staff, in fact, all of our staff have also recorded these daily messages of encouragement. We're now getting some of our parish leaders, especially members of our vestry, which is like our board of directors. They are now also recording these messages. So that's the way to continue to be connected to the members of the congregation. We had the idea of asking members of the congregation to put a candle in their window and to keep it burning. This is something that has been done in the United Kingdom, especially in times of trial, war, and other challenges. And the candle represents hope. It's a sign of hope. And in the Christian tradition, it's the sign of the light of Christ. And so we've had members of our congregation put candles in their windows, and they've gotten other people in their neighborhoods to do likewise, just to have a little symbol that, you know, we have hope and we have faith, and our faith and trust is in God. And then we put on the front lawn of St. Barnabas a banner that says hashtag God Strong. And this is to remind people of faith that our strength comes from the Lord. Psalm 121 says that our help comes from the Lord. And so we have this banner on the lawn in front of the parish that everybody can see. And just as a reminder that we don't depend on one another, but we depend on God for strength. And you've seen this, you know, Boston Strong or Las Vegas Strong after a mass shooting there, or El Paso Strong. And so we've done that to just remind people that our strength does come from God. And then finally, I guess I would share, like Nell, we've been trying to be innovative in providing services weekly. You know, this is under the heading of be careful what you wish for. Many of us have been saying for years that we have to learn to do church a different way, because people aren't coming to our sanctuaries the way they used to. Whatever tradition, Roman Catholic, Protestant, Jewish, whatever, there's been a decline in attendance. And so now we have been forced to be innovative and to do church in a different way. And it's something that we've already committed to continuing doing when the pandemic is over. We will now always live stream our services so we can reach a larger number of people. And so that's been very well received.
Nice.
Well, that's great. Well, thank you to both of you for really describing how, I guess, worshiping is evolving. And sometimes some of these changes, as we've seen in many aspects of our lives, as Dylan was talking about before we hit record, you know, the ability to actually connect in ways that perhaps we didn't before. And so things like ministers of encouragement that really up the game of engagement with the people in the faith community is really important. And I really love some of those ideas, because I think we can all take them in our daily lives if we're whatever faith we practice, or if we practice no faith, we can still step up our engagement and look out for our fellow citizens. And so that's really important.
And Troy, another thing that we've been doing on a weekly basis, we've invited all of the clergy in Falmouth, but on a weekly basis, the clergy get together on a call anywhere from 30, 45 minutes to an hour, checking in. In some ways, I think
Nice.
it's clear to me the clergy are on the front lines, because, you know, we're dealing with our congregations, but we're dealing even with a bigger congregation now, because we're out there on social media, and some people rise to the occasion under this crisis. Other people have been stressed out. So it's given us an opportunity to get closer and to work together. We usually met maybe once a quarter, and now we're meeting weekly. So it's really strengthened us. And I think the benefit moving forward is going to help Falmouth even be stronger.
Well, and that's really important. And I think one of the things that you touched on, Nell, was what I call this Dickensian episode of ours. It's all at once, the best of times and the worst of times. And we have seen undoubtedly the best in people. And unfortunately, we've seen the worst in people. Bill reported to us before we came on air about an episode in Mashpee last week at the Polar Cave Ice Cream Shop, where an employee left because they were treated so shabbily. And I reported in my column a week or two ago about a similar episode that I witnessed at Somerset. I'm not quite sure what it is about ice cream that that invokes bad behavior, but we are seeing it, and so it's important for us to talk about it. So because it's important, I think, that people know that it's okay to feel that angst and the worry, because we're all feeling it. But it's also important to know that there are places we can go, including just conversations like this, but also our many faith communities in Falmouth where people can be provided some comfort. Dylan,
Yeah,
I know Will was talking about ways in which they're sort of reinventing worship. You're quite literally having to reinvent government and find a way for 160 members of the House to get together and do the business so that average citizens and local governments and businesses throughout the Commonwealth, can be assisted by the work that you're doing. So just give us a quick overview of some of the issues that the legislature is working on.
Sure. Well, thanks, Troy, and thanks for this forum. It's a real service for the people of Falmouth. So last week was the first time that we met as a legislature to vote in a formal session, meaning that all 160 members are formally voting. Before that, things were done through informal session, which means that there's basically a skeleton crew at the State House, and every item that passes through informal session has to have everyone's support, because if just one person objects to it, then it doesn't pass. And so last week was the first time we all met 160 people on one form of technology, instead of doing it through Zoom or video, which has had some security issues. We created these new rules around kind of an elaborate call-in system, and I'm just mindful that the Massachusetts legislature, in its almost 400-year history, has never experienced anything like this. And Massachusetts, we're the oldest constitutional democracy in the world, and so it was pretty incredible to be a part of voting remotely for the first time. So we've taken up a whole host of pieces of legislation over the past several weeks. Happy to get into any number of them. But last week, one of the was important bill that we passed in formal session to allow the treasurer to borrow, basically to close our massive deficits that we're facing. In April alone, we faced a $2 billion deficit over last year. That is in part because we're facing large deficits every week because of the lack of tax revenue coming in from this crisis. But also, as folks remember, we delayed the tax filing deadline from April 15th to July 15th. One, to give people some needed relief, but two, to align with what the federal government did so that people would have that consistency there. But obviously moving that creates a massive shortfall in our financing. And it's looking like we're going to be facing hundreds of millions, up to $1 billion hole this year. And then next fiscal year, somewhere between $4 to $6 billion. So there's going to be a lot of hurt, and unless the federal government comes in and gives support to the states, it's going to be pretty dicey. Massachusetts is in a better position than almost any other state in the country, because in the legislature we have allocated over the past several years a significant amount of money in our rainy day fund. Right now it's around $3.5 billion. So that will help us to close some of that, but that's not going to be nearly adequate. So I mean, the other piece, and I'm happy to talk about bills too around allowing towns to a whole host of municipal guidance around town elections, town meetings, open meeting law, to small business pieces around, and then pieces around housing, around people, not making sure that people aren't being evicted, and making sure that people with mortgages aren't being kicked out of their home. So, but one of the things I kind of want to press upon is that, kind of the greatest form of business stimulus that we can have is to slow the spread of this disease. And people are pulling back and physically distancing, yes, because of government orders, but even more so because of fear, understandable fear because of this virus. And look, if the government reopened everything tomorrow, nothing's going to go back to 100% of normal, because everyone has a ton of fear as well. And so that's why the best thing we can do for businesses is to get a handle on this from a healthcare perspective. And from that angle, the state is taking a lot of meaningful actions, but two that I think might be most important, and two that experts say are most important. One, to get to Gary's comments earlier, is around testing. We are ahead of almost the entire nation on testing, but nowhere near where we need to be compared to other nations that have taken this on a lot more effectively than we have. So right now, I believe we're around 15,000 tests a day, maybe slightly under that. We need to get to 50 to 75,000 tests a day at a minimum. And the administration, the governor, Commander Sutters, who's in the command center, are making some Herculean efforts to ramp up to that. We need to get to that point, and we need to get to the point at least where 5% of our tests are positive. So that means basically, of all the tests you do, 5% are coming up positive. I believe on Gary's presentation, I think right now we're around 10%. So testing. Then the other piece of that is contact tracing, and this is another area where Massachusetts is really leading the nation. We need to make sure that anyone who gets it tested as a positive, all the people they have interacted with are immediately reached out to and given the proper public health guidance, so that they are quarantining, so that they are not spreading this disease. And Massachusetts has the most robust contact tracing program right now. It's still ramping up. We're partnering with this entity called Partners in Community, or Community Partners. I might switch the two, but they've done a lot of work on this. Partners in Health. I'm sorry. That's right. They've done a lot of work on this kind of worldwide. Right now, one of the good news of our tracing program is that the median response from people who have the median contacts that people who have tested positive are reporting back is that Gary's right. It's 2 people. Did you already cover this, Gary, on an earlier show?
No, you're doing great. You're doing fantastic. Please keep going.
Okay. Well, that's I'll just stop there. As kind of those are the 2 pieces that the state is really focused on, and those are issues. Those are contact tracing and testing are things that we need to ramp up 5x, 10x to make sure that the businesses can really safely open, and so that we get a better handle on this. And I'll stop there. Happy to talk about a little bit about what I know about the reopening plan, and the governor today demystified some of that as well.
I just wanted, before you go, Troy, just say, Dylan, you have just made me feel really good today to hear all this is going on, and to hear that you really get it. And I just am really excited to hear that. It gives me great faith in the government of this state.
Yeah, well, that's the thing too, right? Is that we are, we're doing the best we can, given, frankly, the massive deficit and federal leadership on this, which has put us in the hole that we're in. But we're doing what we can. It would be really nice as a state if we had greater support from the U.S. government on this.
Well, thank you for that comprehensive, really, analysis of where we're at as a Commonwealth, Dylan. And that's so important. And I think for the last several weeks, we've started off this show with Gary sharing a lot of the same information that you just shared. And we do that so that people that are watching understand that responsible opening all falls back on the data we've just been discussing, right? The whole reason behind, as Will called it, physical distancing is public health. The whole reason for putting in all of these restrictions is that so more people don't get sick and unfortunately die. And so it's really important to have someone representing the Commonwealth and a member of the legislature to come on and really validate the information that Gary's been sharing for several weeks right now. And so, you know, it's great to see because, you know, that information really guides the public policy in all aspects of the economy because we share that single objective.
And he's so darn young.
I just turned 30, man.
Wow.
Oh,
I'm like,
Oh, happy birthday.
I don't know. I'm graying over here. I
Bill-
don't know if you can see.
Bill, what would you give to be 30 again, Bill?
Oh, anything. Are you kidding? Restaurants, hotels, whatever you want.
So as we look toward the governor's phased opening plan over the next several weeks and months, really, and the next several phases, so it looks like we're about to embark on phase one, which we don't know exactly what that will entail, but we do know that it will entail some additional activity than what we're seeing now. And this is, I'm throwing this out to anyone on today's show. You know, we're going to have to continue to reinvent, and every week we use the phrase, how will we? And that's an open-ended second part of that question. How will we congregate in restaurants? How will we go to church? How will we legislate? How will we fund our local governments? I mean, you know, the second half of that question is limitless, but I'll throw it out there for our panel and our group. You know, as we get ready to go into phase one of reopening, what are the more important how will we questions for you?
Yeah. So I'll jump in first, but would love to hear what Nell and Will think too. But you know, to the reopening point, the reopening is going to be about is going to be driven by healthcare data and not these kind of dates set, right? It's going to be driven by the data, not just some kind of date down the road. And you know, the governor outlined a kind of a 4-phase approach, and so I think there's kind of 3 main components that will guide these phases, each of them, and will guide every business. And I think that is kind of, you know, well, one is like looking at, okay, what industry is and what the working group is working on is kind of what industries are going to open and in which phase are they going to open. And of course, the lowest risk ones are probably going to be in the first phases and the higher risk ones in the second phase. And then the second piece of this is, okay, what protocols do those industries that are going to start opening, what protocols are in place for each of those workplaces to make sure that they are safe? And I think, you know, one, that's got to come from guidance from, you know, healthcare experts and epidemiologists, but also that needs to come directly from those businesses themselves. And so those businesses are going to have to answer a couple questions before they open, right? I mean, one question that I keep hearing hasn't been fully answered from the lodging industry or the short-term rental industry is, okay, well, what happens if someone, while staying in your hotel or staying in your short-term rental, contracts COVID, right? Like they can't leave, right? Does the hotel have to shut down because of that? Does the short-term rental, if it's a week-long rental, you know, that person's obviously they probably have to stay there then for 2 weeks. What happens to the person who is supposed to come in? Kind of what are the liability issues there? You know, there's a similar series of questions you can ask about the restaurant industry, right? Like, a napkin, what do you do with napkins? Is everything single-use plastic now? So that second piece, okay, what are the protocols? And one, that's got to come from the government. Two, that has to be in partnership with industry so that everyone's on the same page. And then the third component of this phased-in approach is, what are the enablers that allow people to work in the first place? Like, okay, what are we doing about like transportation, right? Transportation, healthcare, childcare, right? What are the enablers that allow people to get to work and be able to work in the first place? And so making sure that transportation and childcare are there's protocols there as well, so that when these industries open, people have the enablers to be able to go do the work. So that's a little bit of background. I think that the state is kind of piecing through, and I know the governor and the working group, and I know the Cape delegation has been trying to be really thoughtful on this as well, along with, of course, the chambers in partnership with healthcare experts.
So, Bill, you're on the front lines of a couple of those examples that Dylan cited, and Michael, I know you're at the epicenter of some of those discussions too, and those are really complicated questions without simple answers. But I know, Bill, you just opened up the Flying Bridge for Takeout last week, and so you're starting to really answer some of those questions in the work that you do.
I'm probably looking towards the end of June before that restaurant's open full time. And even then, I don't know exactly how it's going to be, because as Dylan pointed out, if one of the wait staff all of a sudden contracts COVID, does that close me down for 2 weeks? That's an excellent point, Dylan, as you mentioned the hotels. I own a hotel. The employees don't want to go in and clean a hotel room. They don't know what the person's been like that was in there. Did the person have COVID? Should I go in and clean it and fog it and all that type of thing? And it's fascinating. You said that that what happens if someone does contract it while they're there, and then what do you do? So this is going to be very, very tough. The new normal, as both Will and Nell pointed out, it's a whole new world. I mean, the way that people go to worship, the way that people go to restaurants. I don't personally believe they're all going to go rushing out to restaurants. I'm certainly not at my age. I've got to cool it for a while. Dylan, you might go out for me. Go, please do that, will you? I need the money.
We can Zoom together while I'm there.
There you go.
I won't be eating at a restaurant anytime soon.
It'll be difficult. It'll be difficult. And Mike, you got the worst job, because everyone's saying, how do you tell tourists to come to God?
Well, it's very complicated. It's like you say, and I think part of it is people are starting to think ahead, and I really do want to thank, Wendy Northcross and the Cape Cod Chamber, really partnering with the local chambers and being a voice as far as some of those questions. Are doing a great job in dealing with the administration, and, our own Board of Selectmen making some really tough choices. And even this Thursday, we're going to be meeting the chamber or the Board of Selectmen, health agent, et cetera, be talking a little bit about the opening. Particularly, I know a lot of questions have been brought up about Main Street. And, some people are talking specifically about a closing of Main Street, and then, back to the point that becomes very, very complicated. And, we have about 55 chamber business members along Main Street, and you would very much be surprised that the reaction to something like that is very mixed. People have concerns regardless on it. And it doesn't necessarily mean that that's the answer. It's providing a relaxation of rules to enable restaurants and retail to be able to expand their sphere of operation. So, from the chamber's perspective, we want to see that every business has an opportunity to express their concerns and their opinions, and that whatever policy is brought out is going to be good for all. And also, it's going to be for the entire town. It's not just along Main Street, but it's Woods Hole, it's North Falmouth, East Falmouth. Bill, in your restaurant, the Flying Bridge, you have a lot of space around you. So any relaxation that's going to enable a restaurant to maybe get out on a sidewalk or a parking lot, that can work throughout, the entire town or a retail operation. But, I'm really glad Will brought up the physical distancing, because I've been using social distancing. And Will, I'm going to be using that going forward. But, it's very, very true. It's kind of like, you open one, you come up with one solution and it creates other challenges. We've heard people saying, are there going to be hand sanitizing stations? How do we deal with our public restrooms? There's so many things, but I am encouraged the town at this point is starting to talk about it. And so, Nell, we see your name, but not your face.
She's having trouble with her internet connection, so she'll be back as soon as she can.
Okay. So, you know, but the thoughtful approach, because you're right, we don't know what those phases are going to include. Is it 25% of restaurant capacity? Is it 50% of hotel capacity? And then, you know, like to Bill's point, many of our neighbors that own these businesses really rely on tourism to make ends meet. And there's a lot of people, I'll be quite honest, you know, I get a lot of emails and phone calls from people saying, you know, I really hope the chamber's not going to be promoting tourism this year. So you're right, Bill, we are kind of in the middle of it. It's really challenging to try to find a balance and an equilibrium and try to understand. And the only answer really is Dylan's answer, is the health has to drive it. And that when it is safe to do so, that's when things will be open, and that's when we'll do our job in helping to promote, not before. But we all have to, I think, listen to each other's concerns and come up with a very measured response that's going to match that phased reopening, but do something that's going to be good for all, for the entire community. Very challenging.
And that really is, regardless of whether you're a restaurant or a chamber of commerce or a faith community here, those are some of the challenges that we're facing. Will, you know, obviously, people getting together in a small space, a church, is not very different than people gathering in a restaurant. They're just there for a different purpose. So some of these questions I know you're facing as well.
Oh, Will, your mic, you can turn your mic on.
Mike, you can't see it. Your mic.
There we go.
Thank you for that. Yeah. You know, I want to say, people keep talking about, well, we got to get things back to normal. We got to get things back to the way they were. As a faith leader, there's a huge part of me that hopes we never go back to the way things were.
Right
we
on.
were really mean to one another. And there was a lot of sexism and homophobia and racism and misogyny in our hearts, and a lot of evil in our hearts. And so that had become normalized. It always will exist as long as they're human beings. But I'm hoping we can use part of this quarantine to place our hearts in quarantine and do some work on transforming our hearts during this time. We have had, in this community of St. Barnabas, we've had 5 people die since the orders came down to stay at home. That is incredibly challenging for families who are grieving, friends who are grieving those deaths. I don't know when we'll be able to have memorial services. I've done one graveside, but someone told me yesterday, you know what? We were planning a big memorial service, but we're satisfied. We're satisfied that our loved one has gone on to their greater reward. We don't need to do a big thing in the church to celebrate their life. So maybe the new normal for us in the church is going to be, we won't have as many large funerals as we once had. What do we do about communion? That's been a big question, you know, and I've been reading and following what's happening in Episcopal dioceses around the country. And some people are talking about putting communion in little plastic bags, and other people are coming up with other creative ways to distribute communion. I just don't know. But the most important thing, and I couldn't agree more with what everyone has said, but Dylan in particular, and Michael and Gary, you know, this has to be driven by science, by data, by the health experts that we have. I am not interested in opening up St. Barnabas to congregate again until I'm sure that we're not going to infect one another. You know, churches typically have older members in their congregations. My goodness, we have to be especially sensitive that we don't expose people, we don't jeopardize one another's health by moving too quickly to get back together. As much as we would love to do that, and as much as we enjoy doing that, and we enjoy the congregational singing and all, right now is not the time to do that. I'm willing to wait until the coast is really clear.
And Will, to your point, when we get together as clergy, including the Falmouth Jewish congregation, everybody feels the same way. The people that we meet with absolutely feel the same way. And what we're doing is looking for other ways that we can be people of faith in the community. The first thing is to follow what the scientists and the health people are doing. The other way is how can we help businesses? How can we help the agencies in town? How can we help the Falmouth Service Center, the Senior Center? And, you know, we're doing it in small ways. Before this happened, people would come to a faith community for meaning making. And now I find people want purpose, which is a little bit more immediate. And we've enabled that by creating a small meal program with a local business in town, and we're delivering meals, helps the local business, helps us to get out to feel like we're doing our part during this time, and always modeling good physical distance behavior, the mask, the gloves. So I think that we're learning a lot more about ourselves and what it means to be people of faith that we wouldn't have otherwise. We do miss being together and that physical touch, but that's not going to happen. But we've been doing drive-by birthday parties, drive-by Mother's Day. We're having a drive-by graduation celebration for our seniors. Getting creative.
And we really have had to. I think, Nell, one of the points that you made that I'd like to really highlight, because I've seen it in my interactions with people in the community and the work that I do as a columnist. So many people have found a way to contribute in ways that perhaps they didn't before, and that's really been one of the few silver linings in this somewhat dark cloud of this pandemic, is that we really have seen people coming up with ways to focus on the solution and to help solve issues in our community, and maybe some people that didn't think like that before. We've seen, and Bill has just as he does every week, put up the Falmouth Cares logo behind him. More than
T-shirts.
More than 700 people in our community have purchased T-shirts to benefit the Falmouth Service Center and belonging to each other. But as important, I would say, if not more so, those are two wonderful organizations, and we've raised thousands of dollars to help them, thanks to the generosity of Bill and his wife, Linda, and Sam and Judy LaRusso. But people are wearing those T-shirts and taking photos as a sign of solidarity and that we're all in this together. And all three of our guests on this show today are on the front lines of really helping people see that we're all in this together. And I think that's really the most important outcome of what we're all going through right now. And it's folks coming together to give meals, and what's even more amazing is that not every single act of kindness needs to or gets publicized. People are realizing that it's okay to do good things for others and not seek publicity for it. And it's ironic for me as a newspaper columnist to say that, but that's really been a bright spot, and I see that every day. And Dylan, I'm sure you see that in your work too, because the work that you do in constituent service and reaching out to people who need help is as important as the legislative work that you do.
Yeah, and I'm glad you raised that, Troy, because talking about the front lines and helping people with their daily lives. One of the things that we've done on the Vineyard is we put together a group of or 10 or so people who make calls to seniors, people over the age of 75 on island. Yes, to connect them with services if they need them, like issues around food security or heating and the like. But more than that, it's the primary purpose is just a check-in, just to say, hey, how are you? How are you holding up? And making a touch and a reach out to someone who's their neighbor, just to say, a human connection, human to human moment. How are you? Like, tell me about your life. We want to do something similar in Falmouth, and probably will after, I believe, the 19th, because I know a lot of people are making phone calls right now for an important election coming up. So we don't want to detract from that, but that's something we hope to replicate in Falmouth in the near future. The other thing around, people experiencing this in their daily lives, the thing that our office has gotten more inquiries than anything else, and like a couple weeks ago, maybe 10 to 15 inquiries a day. Now it's down to around 5 or 6, but unemployment, connecting folks with unemployment has been one of the central roles that my staff has been on top of in the last few weeks. And that's, our employment system has never seen anything like this in history, massively overburdened. We've ramped up the number of people, the number of workers at a scale, 10x what I was ever seen before, but still there's a lot of backlog there. And so our work to try and reach out to folks on their behalf from Falmouth to connect them with unemployment has been really meaningful for us, because if many Americans, over half, live paycheck to paycheck, and so making sure that they get the funds that they need to survive is really important. So if anyone has any issues who's watching this with getting unemployment, please reach out to me personally. My email address, if you just Google Dylan Fernandes, it should be on the first page that on the MA Legislature website that comes up. That goes right to me. I see all of them. Connect with me. And then the other thing I want to point out too, and this was a little late coming, and this came through the CARES Act, but the pandemic unemployment assurance which is particularly important for the Cape and Islands, right? This is for this is for people who are self-employed and contractors, 1099 workers, not the usual W-2. There are so many folks so many small business folks on the Cape and Islands who are just self-employed, have really small shops. These are our artists too, right? We've heard honestly glowing things about how easy this system is, and how user-friendly it is, and how people are getting the support they need pretty quickly. But if anyone who's out there listening, who's a 1099, who's self-employed, who's a contractor, and needs help with that, please reach out to our office on that issue as well.
That's great. Thank you. And the outreach that you described with folks in the vineyard that could be coming here to Falmouth is very similar to the ministers of engagement that Will talked about earlier in the show. So it's really great to see that we understand. And I think, Will, you mentioned this at the very beginning, and calling it physical distancing rather than social distancing, because one of the things that we're seeing is increased connection. It may not be physical, but people are making an effort to stay and become connected in ways in which they never were before, and that's really important. One of the ways then that we are deciding to stay connected to the community is through the charitable side of Falmouth Cares, and as I mentioned a couple of minutes ago, we're selling T-shirts that are raising money. All of the proceeds from each T-shirt goes split between the Falmouth Service Center and Belonging to Each Other, which is a homeless prevention nonprofit that actually began at Will Mebane St. Barnabas Church. And so we're working hard to keep people connected in that way as well. I'll throw it out to our panelists as we near the end of our time together. We think that this has really created, in a very positive way, something that people can rally around and show solidarity and be proud of their community, and be proud to be part of a town that is such a community. What are you hearing? Same sense out there that you can help us sell T-shirts and benefit those organizations by giving us your feedback?
Well, Troy, I have to say that we are very proud to have a Falmouth Cares banner out in front of our faith community. I love the fact that we are all connecting, whether it's businesses or business organizations, the town. Dylan, you should know that every Monday I'm on a call with the Falmouth Service Center, the Department of Human Services, the Falmouth schools, the superintendent, and talking about how are we feeding people, how are we getting resources to seniors and to students. And I knew Falmouth always cared, but now I'm seeing it. I am really seeing it and seeing sort of that interagency connection that is happening.
It's
2
one of the
degrees of
reasons-
separation here.
Exactly.
It's one of the reasons I came to Falmouth now just over a year and a half ago, because I knew a little bit about the community, how much people do care for one another. And what I've been encouraging folks to try to hold on to during this challenging time is 2 things. One, to always maintain an attitude of gratitude, because we are still blessed in so many ways. We have much for which to be thankful and grateful. And even though we can't be, with that, we are still together. We're still together even when we are apart. So I leave those 2 thoughts with you all.
Yeah. And I, well, one, I just want to, thank Nell and Will for the congregation that you're continuing to give people and your ability to bring people together in such meaningful ways. And look, Falmouth is, I've had the privilege of growing up here and living here my whole life. And it's just an incredible giving community. And, look, a lot of us love it here because of our pristine environment and amazing beaches and the like. But I say this a lot. What makes Falmouth really, a beautiful, special place is the people here, and it is such a community of volunteerism and giving. It looks like Bill just went to the beach.
Beautiful environment. There it is.
Yeah. But yeah, it's really a remarkable community where people continually step up to help each other out. So thank you. Troy and Michael and Bill and Gary as well for providing this service among so many others for people in town.
Well, we do it because Falmouth cares, but that's real, and it's been a real pleasure working with our panelists the last several weeks to bring information to you every week. Not only the empirical information that Gary shares, but the real heartfelt information that the 3 of you have shared with us this week and that our previous guests have shared. So
this is fun. I can't believe this was an hour. It flew by.
It really did, and we'd love to have you back, all of you.
You were great, by
the
the way. Thank you.
Oh, sorry. Go ahead, Bill.
No, I think they're great. The 3 of them are absolutely fantastic.
Absolutely.
This is fun. Yeah, thanks, guys.
Thank you.
Go.
Great.
Thank
It's a great way to continue.
But I
to
need
share
one of those backdrops. I need Falmouth Care.
We got to send you that next time. That's right.
Gary will teach you how to do that now.
Yeah.
I will email it to all of you, and we thank you very much, Reverend Will Mebane, Reverend Nell Fields, and Representative Dylan Fernandes for joining our regular panelists, Bill Zammer, Gary Bacon, and Michael Kasparian. And we're really grateful that we were able to bring you this information and emotion-packed hour. And we're all here because Falmouth cares. Be well, and we'll see you soon.
The Falmouth bells were tolling, and our hearts sang on. Was it the spell of our town, or an April dawn? Who knows if we shall meet again? But when the morning chimes ring sweet again, I'll be seeing you in all the old familiar places that this heart of mine embraces all day through. In